let's talk about what we do, the concept of functional medicine, and let's talk about some of the things that are wrong that need to be corrected to right that ship.
The principles of functional medicine are wonderful because the goal is to try to improve function, making sure hormones are optimized, blood sugar stabilized, making sure immune system is competent. Conventional medicine, pharmacology is completely opposite. Everything is there to block and inhibit, right? And that's not really increasing function. That's shutting down a part of physiological function. The goal of functional medicine is, are your physiological functions all operating at their peak? Can you have normal bowel movements throughout the day? Is your energy level stable throughout the day? Is your cognitive function stable? The goal of functional medicine by itself is a phenomenal concept. Except one of the problems we have with it is like people that practice functional medicine may not really understand it that well. Functional medicine is all about depth. How deep can you go? Right. And how well can you see these interconnections with the person? And what do you do to improve physiological function? People sometimes try to simplify the steps involved. And one of the things that's kind of, I think, translating to functional medicine that's become made it a little bit more inefficient for both the patient going through treatment and the practitioner providing it is it just becomes to which supplements do we start with? It's really become the supplement game. And it's really become like, how many labs do you order? And this partly, I think, influenced by the main educators of functional medicine have always been nutraceutical companies and laboratory companies. Finding them is not the hard part. Prioritizing where to start and how they all interact with it is really the skill of functional medicine.
Great point.
And this is where patients get frustrated because now they're spending thousands and thousands of dollars on tests that they may doesn't really help to start in the right place, and then taking all these different supplements because they're treating every lab marker that's abnormal with a supplement, just like people treat every drug with every disease with a drug and end up with multiple drugs. And this is, I think, where things can go wrong quickly in a functional medicine approach.